Welcome, everyone, to the show. Recently, one Hollywood actress bravely shared her personal struggle with a debilitating condition. It's more common than you think.
I felt like I had the worst UTI of my life. Unbearable pain during sex and a vagina that felt like somebody had stuck a hot poker up it, then gotten a phone call from their agent and was like, excuse me, just for a second. Every test I took came back with a clean bill of health. I went on to see dozens more doctors, specialists, psychiatrists. I even tried hypnosis, all with the same result. You're fine, it's in your head. Until, my dear, what you have is shockingly common. It's called pelvic floor dysfunction. 1 in 3 women have it, and you can stop eating addicting pain pills like they're Tic Tacs, because we can fix you with simple physical therapy. I'm sorry, did you say physical therapy? And my answer was in Pilates?
So Zaja was clearly able to make a joke out of this whole ordeal, but she endured 6 years of pain due to pelvic floor dysfunction. Dr. Anita, more common than people realize.
Absolutely, absolutely. And you know, I love pelvic floor physical therapy, and like she was saying, it is very common.
We all do.
Yeah. Do you? How have your sessions been
Gotta
going?
exercise everything.
You do? They're muscles, right?
That's right.
But the average woman will see 5 doctors before she gets the right diagnosis. And for everyone at home, your pelvic floor is basically a group of muscles, and those muscles form a sling supporting your bladder, your uterus, and rectum. Well, sometimes just because we don't know why, and other times it's because pregnancy, childbirth, aging, certain pelvic surgeries, things like that, that sling can become weaker. And when that happens, you get the pelvic floor dysfunction that can be associated with problems with urination, defecation, or chronic pelvic pain.
Why is this being missed so much by docs? I don't think they talked about this in medical school.
Well, that's why, you know, a lot of people miss it.
That's why I'm paying attention.
Yeah, it's not at the top of our list.
You're awfully into it.
He is very interested in keeping those.
But the best part about this whole concept of physical therapy for pelvic floor dysfunction is if women do these exercises, they can potentially even prevent the dysfunction in the first place.
Yes.
I mean, really, in a way, shouldn't women all be doing preventative physical therapy down there?
Yeah, yeah.
So are these just
I mean, really, you go to the gym, you work out your arms, you work your legs, work your pelvic muscles. You know, not only can you prevent the urinary and, you know, urinary problems or problems with bowel movements, but it also can make for a better sex life and better orgasmic potential.
So are we talking Kegel exercises here?
Yeah, you are. But with pelvic floor physical therapy, you see a physical therapist who has special training in this area.
Really?
And yes, and they can help you with. Would you like me to sign you up for a session?
I'm learning.
What I love is that we've been having fun with this, but 75% will see an improvement with physical therapy, which is a remarkable number. And maybe that's why doctors don't think of it as much, because it's not one of those, okay, here's your problem, here's a pill. Here's your problem, here's a surgery. It's really more, the symptoms can be a little bit confusing early on and vague.
Yeah, and you can have problems with urination, so they may think it's a urinary tract infection. They may think it's a sexually transmitted infection. You're having problems with bowel movements. They may say, oh, it's constipation. You're having chronic pelvic pain. Lots of reasons for that.
And the point is, it's not like there's some simple test you can send out. So
exactly.
That's why
so you have to rule out
visits.
things, and then you go.